Hello, all you. This is on my weekly little email. I wanted to chat with you. We had a couple good victories this week. A couple guys that had PSAs in the 14s and had biopsies that had Gleason 6 and Gleason 7s. And were told they had to go to radical treatment, radiation, and ADT right off the bat. And within 60 days, both of them reported their PSAs were under 4, which got them to get the doctor to say, let's watch and wait. That's a complete victory because this stuff was keeping them up at night and causing their families a lot of stress. And this is a typical result if with dedicated protocols, and it saves you a lot of aggravation. So I've got a video this week. I've been studying a little bit about the effects of a liposomal type melatonin in cancer, and it's been very enlightening how effective it actually is. And there's in vivo and in vitro studies. The in vivo ones are the only ones I'm concerned about, but I invite you to watch this video all the way through as you're doing, and you'll see the benefits of melatonin. I would definitely suggest you make it part of the protocol. I don't care where you get it, of course, just get the liposomal type because that is the one that works. It's absorbed at an 80% higher rate than the conventional type that isn't liposomal. So, all right, stay strong, and I'll see you on the next one.
While melatonin is widely known for regulating sleep, high-dose therapy, often exceeding 100 milligrams, is being studied for its potential oncostatic, cancer-inhibiting properties. Using a liposomal delivery system is a specific strategy to bypass the limitations of standard oral supplements. Here is an explanation of the mechanisms and why the liposomal format is used in this context. 1. The liposomal advantage. Standard melatonin capsules have low bioavailability, often only 10 to 15%, because they are heavily processed by the liver before entering the bloodstream. Bioavailability. Liposomal formulations encapsulate melatonin in tiny fat bubbles, lipid vesicles, that protect it from stomach acid and bypass the liver's first-pass metabolism. Intracellular delivery. Because liposomes mimic the body's cell membranes, they can fuse directly with cells, delivering the melatonin directly into the cytoplasm and mitochondria, where its antioxidant effects are most potent. 2. Core anti-cancer mechanisms. At high doses, melatonin moves beyond sleep regulation and acts as a powerful bioactive molecule. Apoptosis induction. Melatonin can trigger programmed cell death in cancer cells by increasing oxidative stress specifically within the tumor, while simultaneously protecting healthy cells. The Warburg effect reversal. Cancer cells often switch to a less efficient metabolism to fuel rapid growth, the Warburg effect. High-dose melatonin can suppress this metabolic shift, essentially starving the tumor's energy production. Anti-angiogenesis. It has been shown to inhibit the formation of new blood vessels that tumors need to grow and spread metastasis. Immune modulation. It can enhance the activity of natural killer NK cells and T lymphocytes, which are the body's primary defense against malignant cells. 3. Synergistic effects with standard care. Clinical research often focuses on melatonin as an adjuvant therapy. Research into high-dose melatonin, specifically levels near 120 milligrams, for prostate and colon cancers has shown significant promise, particularly when used alongside traditional treatments. Recent clinical data and mechanistic studies from 2024 to 2026 highlight several key findings. 1. Prostate cancer, PCA. Research identifies prostate cancer as highly sensitive to melatonin because it modulates both metabolic and hormonal pathways. Androgen receptor modulation. Melatonin can physically interfere with androgen receptors, essentially helping to block the signals that drive prostate cancer growth. Survival rates. A significant clinical study, reevaluated in late 2024, observed that in patients with poor prognosis prostate cancer, those taking melatonin alongside hormone and radiation therapy had a median overall survival of 153.5 months, compared to 64 months in the control group. Metabolic starvation. It acts as a competitive inhibitor of GLUT1, a transporter that cancer cells use to gorge on glucose. By blocking this, Melatonin helps starve the tumor cells of their primary fuel.